I was just your average person living life to the fullest, working, having fun with my friends. I actually have Crohn's disease. So I'm really I guess, in tune with my bowel habit. And I sort of have taken all sorts of medicine. At that point, I had been in remission for quite some time. So a year and a half earlier, I'd had a very clean, probably the cleanest colonoscopy I'd ever had in my life. I was in the best shape of my life. I was eating well, like working out, usually, I think I would say 5 to 7 times a week. And over the course of a few months, I started noticing subtle changes, weight loss that I really thought was from the Zoom I was doing. But then there was severe fatigue. Then there was increased blood in my stool that I hadn't ever really seen before. But the biggest symptom, I think, for me was the fact that I felt like when I ate, something was getting stuck in me. And I had never had a blockage in my life for any reason. And so I was like, well, maybe it's something like that. I don't know. And so I scheduled an appointment with my GI doctor, who I was very lucky that I had a GI doctor. And so I was supposed to have a colonoscopy later, like maybe a year later. Because of the symptoms that I was telling her, she, instead of scheduling a colonoscopy right away, she had me drink, some of the stuff that helps clean you out to see if maybe I had a blockage. She did an x-ray, and I drank some of that stuff, and I felt maybe good for like a day. And so that was alarming to her. So she scheduled a colonoscopy for a week after that. So in human terms, it's not the most pleasant experience, I'm not gonna lie, but I sort of treat it as like a clean out, a full clean out of your body. So it's one of the screening methods for GI doctors to see if anything's going on in your colon. So essentially you have usually a day or two of clear liquids, and then the day before the procedure, you have to drink this, it's called a bowel prep. You have to drink some sort of prep that cleans you out. And when I say cleans you out, it's, very similar to if you go and get a colonic. You drink this stuff and you go to the bathroom so that, by the time you're done, drinking, the only thing that you can see is very clear liquids that are coming out when you go to the bathroom. And that's so that when a GI doctor goes in and does a colonoscopy or a scope, they put this device up to look in your colon to look for abnormalities, any sort of inflammation, any sort of polyps, any sort of redness or irritation. And they can only do that if you're clear. There's nothing that is blocking their view from the insides of your colon. I always insist on having anesthesia. One time I had a colonoscopy without, and I felt it. There is like local anesthesia, and then there is a more advanced type of anesthesia you can get. That's like sort of options you talk with your doctor about. And I always insist on getting that because I don't want to feel any pain. And, there's extra precautions with that. They have an anesthesiologist come and talk to you. But it really is based on your provider and what they suggest. But personally, without giving medical advice, I always want the anesthesia that will put me out so I don't remember, because I essentially wake up after and, I've felt no pain and I don't really remember anything that happened to me. And I remember waking up and she said, I found something. I don't know what it is. I don't think it's cancer, but we took some biopsies. So, that's sort of what led up to me getting screened, those symptoms, but also I think me being my own advocate is probably the reason why I got the screening that I needed. And also knowing my body really well. A lot of people don't necessarily pay attention when they go to the bathroom, but I did. That wait time was probably on the top 5 list of most stressful things in my life besides cancer, because, mentally, I don't know, not everyone hears, cancer when they wake up from a colonoscopy. Some people are diagnosed during that colonoscopy, right? It totally just depends. She mentioned the word, you might have, I don't think it's cancer, but I did some biopsies. Some people that day of the procedure get diagnosed, but anyone that has to wait for any sort of results, I dived into work. I tried to distract myself. I kept myself busy as much as I possibly could. But in the back of my mind, I'm hearing cancer, cancer, cancer. And it's the fear of the unknown. Your life is in the hands of somebody else and not yours. I get the phone call and I know, like, she didn't even have to tell me. I know that I'm about to go through the worst journey of my life, the biggest challenge I've ever faced. And so I get on my walk over to her office from work. I leave everything. I work in a research lab. So I was in the middle of a project and I told one of my friends, there's an emergency. Could they take over? And, I walked across the street, got on the phone with my mom and was crying. And, I got into her office. They put me into a separate room. And that's when my life changed forever. And I was told I had stage 3. At that point, I was told I had stage 3 colorectal cancer and I should try to find an oncologist and surgeon as soon as possible because I had had that colonoscopy a year and a half earlier that was clean. They thought it was pretty aggressive. So, I went home and I processed the information. We told people, and really what I did was I asked friends, I asked colleagues, I asked people that I knew that had any sort of experience with cancer about the best institutions possible. And then, I said I got as many opinions as I could get. I got 3 opinions at different institutions. And let me tell you that maybe the treatment was similar, but the surgical options were very different. And I also knew of a friend who I had thought had just gone through colorectal cancer treatment. And so I reached out to my friend to connect me with this person because I knew nobody that had colorectal cancer. And I definitely didn't know anybody young. And this girl was a year younger than me in my high school in Houston. And so I reached out to her, as well as my best friend who worked in cancer research as well, to try to get as many opinions and options as possible. And it's one of the hardest things because you want the best care. But I tried not to go to Google. I tried not to go to Google because there's too much information. There's too much out there that possibly could be unreliable. That I really tried to find people that knew people that had gone through any sort of cancer and ask them, okay, who do you suggest? So they had a suggestion for somebody. I worked at Baylor College of Medicine, so I knew people at Baylor that could help get me in. I had previously had a GI doctor at Methodist because I literally went through GI doctors like crazy. They would fire me at any point multiple times because my Crohn's was a beast to handle at times. So, if you don't have connections, reach out via social media to maybe someone that knows somebody, because when you're diagnosed with cancer, people just want to help you. And one way that people can help you is to, give you suggestions on people who to see and who best to help you than someone that's gone through the journey themselves. I was treated at MD Anderson,
Right.
and what made me, all the hospitals I went to were amazing. All the doctors were amazing. But it was one thing that my oncologist said to me that made me want to go to him. And it was, Allison, you are young. I don't want you to feel like you're just a number. I want to make sure that you understand that I am caring for you and you only. And when I'm looking at your chart, your treatment plan, it's personalized for you. I don't want you to get lost in the cracks. Here is my cell phone number if you need anything. And that was in 2012. And I have yet to use that cell phone number, but that level of, I want to say, trust that he had in me made me have that in him. I don't think every doctor would give their cell phone number to a patient, but I think he knew that I wasn't going to, hey, what's going on? Call him all the time. But I think that, in these big institutions, these big cancer centers, you get a medical record number and you feel like you're just, one in a million people that's being treated there. But knowing that he wanted to ensure that I would not get lost in the cracks and my treatment and my case and me as a person mattered is why I went to that oncologist and started treatment at MD Anderson. I had an appointment that first real appointment was with my oncologist and my surgeon. And so standard of care for someone with my diagnosis was going to be 5.5 weeks of combination chemotherapy and radiation, a little bit of a break, then surgery. And surgery could range from so many different things. It just depended on what they found inside. But surgery and then chemotherapy again. And that's sort of very, very, very broad. but that's sort of what standard of care in 2012 was for colorectal cancer. And I say colorectal cancer because my tumor was in not only my colon, but it was also in my rectal area. So it was a 13 centimeter tumor that they found that wasn't just in one, it was one tumor, but it wasn't in one organ. I went through the radiation and chemo without knowing anything. So that's another fear. You don't know, like I had my scans, obviously, but I had no idea that cancer is growing in me. Is it not growing in me? You have no idea if your treatment is actually working. It wasn't until I had my first surgery after that in September that I was opened up and they realized the lymph nodes that they thought first were involved were only inflamed. It was just inflammation. It had not gotten into my lymph nodes or spread in my body. So it was then downgraded to 2C, which is better. Obviously, it's always better to be downgraded than upgraded, and it's rare that happens. But so that happened to me. But also when they did surgery, they, because I had Crohn since I was 12 years old, the amount of inflammation that they found in my colon, they said when they opened me up, my colon sort of fell apart in their hands. So my surgical wishes were to have a J pouch if possible. I did not want to have an ileostomy or a colostomy if possible. Well, since they took my whole colon, they couldn't do a colostomy bag, but they could do a temporary ileostomy and take what was left of my inside. I'm using my hands, but take what was left in my abdominal area, stretch it to make something called a J pouch, which when, the recovery is sort of to let that heal. That's why they let you recover from surgery before they do chemotherapy. Again, let that heal so that your body can sort of get used to, your new organs again, right. And your digestive system could start working again with a lot less time from when you eat to, you get rid of whatever waste you have. My chemotherapy was I want to say easier than others, but it was not IV chemo. It was a pill chemo. I still had lots of different side effects, but so the same time I was going in for radiation every day, I was also taking this chemotherapy drug, and it's sort of to tackle the cancer two different ways at once. And so radiation is every day I was working throughout all this, but at 5:30 p.m. I would go over to the hospital and they tattooed me when I was first diagnosed, and they would have I would get radiation to my abdominal area targeted towards, specifically targeted to where my tumor was. And at the same time I was taking this chemotherapy. So the side effects from that can range. So the one thing they don't necessarily tell you, or they really don't necessarily explain as well as I would like, and they're much better about it now, is the radiation also causes, depending on where it is, burning. This is essentially radiation to your skin. And so I'm trying to think of a way to put it in terms that a woman or man will understand. Essentially, your personal parts could be red, could be irritated, could get blisters. And there's creams that I can't remember all the names of the creams that my doctors would give me, but I knew that the burning and the redness and all that would eventually get better, but it was very painful to go to the bathroom anyway. They just, I guess based on their research and, since it's the standard of care, they knew about how long your body needed to recover in order to go in for surgery. So there was no skin in there because they didn't want to give me any extra radiation to my body because I had just been obviously heavily radiated. Review all the surgical options, because as in most cancers, they don't know what they're going to find when they go in. So they could do this, or they could do that, or they could do this. The other thing, so that's sort of surgical things that they review all the different options they can do with you. But then there also was this is crazy to talk about now, but back then it was a very emotional night. My God, I'm gonna cry. I don't cry anymore. Mm-hmm. My parents and I sat there and filled out my last will and testament and what would happen if I didn't survive that surgery. Sorry.
No.
I mean, I tell my story so publicly so often, but that one moment, the night before my surgery, filling all those forms out, thinking that I might not make it off the operating table was tough, but, much needed because I knew as a former, I worked in research. As a researcher, I knew that if anything happened to me, if I had organs that could save someone else, I wanted them donated. And, the little, possessions and stuff that I had, I knew, where I wanted to leave them and what I wanted to do. So that moment was it was a true, real emotional moment for me and my parents. So that's something that I think is a requirement when you're going into, a surgery like I had. But it's a real moment that can be a struggle for anybody. I mean, you have the fear of the unknown, but then you're also filling out these forms in case of, and it's scary for anybody, but especially somebody young. I think the physical readiness is important, but also the mental aspect of it is really important. And I think psychologically, I had talked to not only a professional but also a human being that had gone through it. So that helped me mentally prepare for what I was going to wake up to, or not wake up to. I think that you don't know. I had never had really any major surgery in my life. So, not knowing what was going to actually happen, was I going to have drains? Was I going to have a tube, NG tube? Was I going to have this, how my life was going to change? I think I had to, like I said, physically, obviously prepare, but the mental aspect of it, I wanted to go into it as mentally able to handle whatever I was going to wake up to. I think it was 14 hours of surgery.
Wow.
It was very, very, very long. As you can imagine, those surgeries are complicated. They get a lot of people involved. So it was, I think, 14 hours, and I think every 2 or 3 hours they go out and tell my parents. And what was funny is that I don't remember a lot of, and I'll tell you a little bit about what I woke up to and how I felt after that. But I just recently went back. So I had, a huge support system, friends and family that really wanted to know, get updates about what was going on the whole time. And I knew I wasn't going to be capable of doing that. So I created an email list. And I think this is helpful for all patients. I created a listserv essentially of all the people that wanted to have updates. And my dad was put in charge of updating people. So as he got an update from the surgeon or the surgical team, he would then in turn send not the exact same update that he got, but an update to the people that cared about me and the people that wanted those updates. And so it took the burden off of me and my mom, who's very emotional like I am, to update people, because getting constant phone calls was the last thing that myself would need after surgery. My mom, and it's stressful for everyone involved, the patient and the caregiver. So those constant updates they were getting, they in turn were sending out to my support system so that they could sort of send their messages, and then my parents would read that to me. So I remember waking up from the surgery. So I woke up to my parents and I was very, very groggy. I had they'd given me an epidural for pain management, which we had talked about before. So I was, you know, told that it would be used. The problem was that it was used, but it was only successfully able to work on one side of my body, and it happened to be not the side where I had gotten a temporary ileostomy. So I woke up, I was groggy, I was in extreme pain. There was tubes all over, drains all over. I had an NG tube. I had, you name it. If there's a opening in your body, I had a tube in it. So I moved finally to my permanent room, and the main things that I remember are looking down and, seeing staples, seeing this foreign object to me, which was an ostomy bag. And at that point, I was told that they were able to create an internal J pouch, and I had this temporary ileostomy that they'd have ostomy nurses help me with, that their goals for me were to get the pain under control and to get me up walking, because the sooner I walked, the better my recovery would be. So It was the most pain I've probably ever been in my life, and probably ever will be in my life, I hope. You have, like I said, multiple possible surgical options. Sometimes you get laparoscopic surgery where they can just do a colon resection. But due to my Crohn's and my history of inflammation in my colon, they had to do an open surgery. So essentially they cut me, and I think from mid chest area all the way down to, all the way down to the very tip of my vaginal area. And so they opened me up, and so with me, like I said, they realized that they couldn't just do a colon resection. But in order for any surgery to heal, usually, and I say usually, depending on your stage, it's different. I mean, I know my colorectal cancer surgical options, but stage 1, 2, 3, 4, all that treatment's different. But at that point, like for me, and quite a few people, usually with rectal cancer. So since my tumor was in my rectum as well, a lot of the like sort of standard surgical standards are they take, part of your inside, and it's an opening on either your right or your left side, and they call that a stoma. And it's like a diversion from, your intestine. It's called a stoma. But essentially your outside are, your inside are on your outside, and then there's this bag that's attached to them. And so that's where your waste flows. Instead of going from your mouth, into the toilet, it now goes into this either ileostomy or colostomy bag. And that is in an effort for your body to heal. So you just had this major surgery, everything sort of has to heal. And then usually the next surgery, which is what I had, is to sort of put you back together. And then that ileostomy is reversed. A colon resection is usually standard. Depending on where your tumor is, they might not be able to do just a small resection. It might be more. If it's rectal, they might do the ileostomy or colostomy. It's very, I want to say researching your surgical options is one of the most important things you can do as a colorectal cancer patient. I mean, you got colon, you got rectal, you got anal. You got sort of all 3 different types of cancer that are in that area. And so things have changed over time. They couldn't do laparoscopic surgery necessarily. Even, this was 2012. I wasn't a candidate for it, but now it's done a lot more often and at a lot more hospitals. So the recovery time and healing from that is a lot easier than obviously if they have to open you. But that next day after I had my surgery, they came, PT, physical therapy, came into my room and said, Allison, it's time to get up. The sooner you get up, the sooner you can get your NG tube out, the sooner we can get this drain out, the sooner we can get that. You got to get your bowels moving again. That's the whole goal of all this, to you get to see something in your ileostomy. You celebrate little victories like that. And so that day 2, I was in so much pain that I was like, I'm not getting up. But then I remembered that if I did, I would get out there sooner. And so I remember I sat on the edge of my bed for a little bit, and they're super patient with you. But I sat up on the edge of my bed, stood up, held my IV pole, and had my pain pump that, actually at that point I still had the epidural, but it wasn't working on that one side. So I still had extra pain management on top of that. And I think I walked outside of my room and walked a few steps around, and then I went back in, but every day it gradually got better. But motivation for me was, I don't know if I was the youngest person on my floor. I would assume I probably was, but you see these older people lapping you on that floor. Everyone's trying to get out of there, and everyone's trying to recover it just like you are. So every day you see the same people. And I'm like, if that 60-year-old can do it, then I can do it. So really it was motivation from not only the PT and the doctors and myself, it was seeing others and how they progressively looked better and better each day that got me out of my bed daily. I mean, I think that you have to go in trusting whoever is going to be opening you up, right? Either laparoscopically or normally your body is going to go through changes. You're going to be in pain. Your body's going to have to get used to whatever organ has been affected. And I think just being patient with yourself is something I try to tell people, because you want to get better as fast as possible. And that's just not, that's not the norm for most cancers, especially with colorectal cancer. When it involves your bowels and your bowel habits, that's a fundamental thing that we all have to deal with on a regular basis. And when someone messes with that surgically, it's not going to happen overnight. And, I talk to people all the time. They're like, how does it get better? Does it get better? And I remember being that person asking others, does it get better? Does it get better? And it does. You just have to be patient and listen to your doctors and adhere to sort of what they're saying. And, as much as I didn't want to get up and walk around, even when I went home after that surgery, I had friends and family come over and we would go for small walks just in the neighborhood, not only to get me out, but, to get me moving, because, your body you're in control of your body, right? And what you do to it and how fast you recover, part of it is out of your hands, but a lot of it is also in your hands. So I think being patient with yourself and your body is really important. I think that people want to know about their recovery time and, when they can go back to work, or if they should tell their coworkers, or what, I think that, I get sometimes a lot of questions about recovery time, and really they say for some surgery, it's definitely dependent upon the surgery, but usually it's, a few weeks, 4 to 6 weeks, 2 weeks, depending on what you have. And, I again, when we say patience, I think don't rush back to a job or to doing certain things sooner than your body is actually ready to. Talking to your provider about what you can and can't do is really important. And another piece of the puzzle is we didn't necessarily talk about it because I think it doesn't, sometimes it fits with people's, treatment plans or not, but with the younger population, I had the option to freeze my eggs at the very beginning of my treatment, but then I got very, very sick and that option went away. But I had to ask for that because there wasn't a fertility specialist at that time at my hospital. So I'm a very big advocate, and people ask me about, should I do this? Should I do that? If you're going to get radiation to your body, 100% you should look into fertility preservation. Be it egg, be it, they can move your ovaries out of the field. There's so many different things that they can do now that they couldn't do a long time, even, 10 years ago, that they can do now if you want to have children in the future. But if you're young, you ask for that consult on that first appointment that you go to. My last message is you're not alone. I thought I was alone when I first started. I looked around the waiting room and I didn't see anyone that looked like me. But if you search and you reach out to, people like you or people like me, we can connect you to the resources you need and the people that will help you throughout your journey. Because even though you're surrounded by your amazing support system of friends and family, you can get very lonely at times. But when you can connect with someone else that gets it and gets you, then I think you really can get the support that you so badly need to get through this journey. And it's also one day at a time. Nobody's journey is the same. So what you might struggle with, someone else might not struggle with, but you're not alone, and taking it one day at a time are those lasting messages that I can give anybody.